you could see, André Fontaine, I am French on both my mother and father's side. I am from Treaty 6. That's where grew up. And Treaty 6 is like Batoche area in Saskatchewan, where Louis Riel resistance happened. So that's where I am originally from. My family's still there. I am a son, a brother of 7 siblings, a husband who I adore, my husband, and I'm a husband to him, and a father of 7. And I fostered up to 7 children for 11 years, not at once, but I was a specialized foster parent, therapeutic foster parent, that I fostered teens, preteens, and teens, but mostly teens. And then my husband and I decided that we would, the last child that we fostered, he was searching for permanency, so we put a plan in place to adopt him. So we adopted him when he was 16 years old, who right now he's our youngest, and he is 35. He's 35 years old. As you can see, I'm aged, I'm bald, so I have a little bit of experience. And the other thing is that I'm a social worker working with Surrounded by Cedar Child and Family Services. That's a delegated Indigenous service here in Victoria. I am now living on the Algonquin land, known as the Songhees and Cossepson nations. So if you don't mind, those that are brave enough to put on their cameras, I really appreciate that, because as a trainer, I'm just talking in the void, in the black, darkness. So it's just to have some kind of seeing people's faces, nods, it just is really helpful for a trainer. So if you're not too shy, if you could put on your cameras, I would appreciate that. If your system allows it, because some systems don't allow it, and I understand that. Thank
Yeah,
you.
Andre, just so this meeting is a webinar, so the way
Oh,
we
so
have
they
it set
can't.
up, that is correct, yes.
Okay,
Yeah,
so I
no
won't see
problem,
you.
sorry.
It's fine. I'm fine with that. Okay, thank you. So the Indigenous Caregivers of BC is a program administered by the Indigenous Perspective Society. This allows us to continue our mission of supporting and empowering caregivers within the Indigenous community. For many years, Indigenous Perspective Society has been providing pre-service training to foster parents, ensuring that they are well prepared to care for Indigenous children. This training is also available not only for the Indigenous caregivers, but also the non-Indigenous caregivers that are caring for Indigenous children, emphasizing cultural understanding and sensitivity. Our work is grounded in cultural safety, trauma-informed practice, and restoring Indigenous ways of knowing and being. This training reflects that commitment is not just about recognizing or identifying harm, it's about finding paths to healing that are culturally and spiritually relevant to the people we serve. So, what is the purpose of today's webinar? Well, first of all, I do want to welcome each and one of you here today. I get excited because I was a caregiver myself, and I know training is really important. And when you're talking about very delicate and hard conversations to discuss, it's even more, it's even it's even better when people come together that want to work through things like that. And it gives me hope for the kids that are actually in your care. So today's webinar will be addressing the nuance of sexual behaviors in children, highlight some of the indicators and impacts of these behaviors, and provide some tips for caregivers and resources for addressing these behaviors in a fulsome and empathic manner. This presentation is meant to support caregivers in recognizing, understanding, and responding to sexualized behavior in children in developmentally appropriate and trauma-informed ways. So what we're going to be looking at today is our talking circle. We're going to be in our circle, we're going to be talking about what is normal and healthy sexual behavior for children and youth. We're also going to be looking at what does sexual behavior in children become, when does sexual behavior in children become a problem? And then lastly is tips for caregivers, giving through a trauma-informed lens and centering healing through Indigenous cultures. So at any time throughout the workshop, if you guys just in the chat box would like to ask questions, by all means, ask the questions. Darcy, my friend, will be monitoring that and will come to me when it's appropriate and ask those questions. We're quite a few online, so we might not be able to get to everybody's question, but we'll do our best. So speak from the heart. This is the contract that I would like to have with us. So I like to speak from the heart, and if somebody's asking questions in the chat room, is speak from the heart, listen with respect, encourage honest sharing and deep listening. Everyone's voice matters, and we hold space for one another with openness and care. No shame, no blame, behaviors, not identity. What I mean by that is we separate actions from who a person is. People are more than their own mistakes, and accountability can exist without judgment or condemnation. Protect confidentiality and change identifying details. What is shared in this circle stays in the circle. If stories are told and you want to retell them, change the names, identifying information to protect privacy and safety. Use first, use person first language. Always put the person before the label. For example, say child with problematic sexual behaviors instead of a problematic sexual behavior child. This honors dignity and humanity first. And then, because this is a difficult topic, take care of yourself. Step out if needed. If you are free to leave, you are free to leave the circle briefly if emotions become overwhelming or if you need a break. Self-care supports community care. While this entire discussion can be difficult to hear, just please take care of yourself. What is normal and healthy sexual behavior for children and youth? Well, it is natural for children and youth to express curiosity about their bodies as they grow and develop. This curiosity is a healthy part of their journey. As caregivers, especially within Indigenous communities, we hold a sacred responsibility to create safe, culturally grounded space where these questions can be met with openness, respect, and care. Our role is to respond in ways that honor the child's spirit and supports their understanding in age-appropriate and trauma-informed ways. Sexualized behaviors are part of a broad spectrum of development. It's important to recognize that not all behaviors are harmful or concerning. Many are simply expressions of learning and exploring. By approaching these moments with compassion, cultural humility, and a strength-based lens, we help children and youth feel safe, seen, and supported. This is a list of examples of normal sexual behaviors for different age groups. It's probably, there's much more that we could put in, but this gives you a sample of what it might look like. For 0 to 5-year-olds, we're looking at children are naturally curious, including about their own bodies. It's common for young children to prefer being unclothed. They like running around naked, feeling good. Curiosity may include looking at or touching other children's bodies. This is usually playful, not harmful. Self-touching, like masturbation, often begins in infancy and continues as part of normal development. 6 to 10-year-olds is exploring their own bodies is normal, may show interest in other bodies, especially during physical change. Asking questions or seeking about bodies and sex part is learning. May play body-related games with peers. I'll show you mine if you show me yours. Comparing your body parts like penis size can happen. Interest in sex-related words or jokes is common. May show attraction or interest in others. Begin to value privacy around their bodies. And for 11 to 12-year-olds, youth may begin to feel attraction towards others. Interest in relationship, example, having crush on a special friend is common. Private self-touching is normal part of development. And sexual exploration with peers, example, kissing, touching, can be typical and not tied to future identity. In imitating sexual behavior seen or heard is part of learning. So we are going to, I hope this works, yes. We're going to listen to a little clip on why talk to your youth, your children about relationship and sexuality. It's about a little bit under 3 minutes long.
Welcome, everyone, and thanks for coming. I know it's tough for parents to get out sometimes.
No, I think it's great to have this kind of support when it comes to talking to our children.
To be honest, I didn't exactly choose to be here. I mean, what does sex have to do with our 3-year-old? I didn't learn about this stuff until secondary school, and that was fine with my parents.
A lot of us, including me, had that kind of experience as kids. What do the rest of you think?
I grew up thinking that sex was something shameful, but that's wrong. I can already see that our 2-year-old is curious about her body. It's pretty funny.
And isn't it better they learn from us rather than other kids who only think they know what they're talking about because their parents don't talk to them either?
My 9-year-old's friend actually told her just last week that girls eat their tampons. She saw it online.
Okay, but still, how do you know the right thing to say? If you get it wrong or if it's too much too soon, couldn't that be harmful?
For many generations, adults thought that shielding children from learning about sexuality was the safe thing to do. The truth is, better educated children are way more likely to make better decisions as they grow up. About everything, including relationships and sexuality. But with sexuality, there's still a double standard that says knowledge could be harmful.
I know you're right, but I'm so embarrassed by the words I'd have to say.
And isn't it better for mothers to talk to daughters and fathers to talk to boys?
Children, especially young children, look to grown-ups for information, simply because we're trusted adults, regardless of characteristics like gender. And one of the best things we can do is give the message that everybody can talk and learn from each other about this subject.
I get it, but I still don't know if I can say the word penis in front of my child.
Embarrassment is one of those catchy feelings. And most of us caught embarrassment about sexual things from people around us when we were very young. So we never get to find out that these words are just words and that it's really healthy and okay to say them out loud.
You're right. Why should I be embarrassed to say testicles or erections?
Nipples?
Masturbation.
Vulva. Clitoris.
Ejaculation.
Scrotum?
Vagina.
Penis!
Good job, everyone. And with a little practice, I think you guys will be ready to make the big talk, many small talks, and become the askable parents that you want to be.
What normal sexual development in children? What biases do we carry? So, just like the children we care for, we are also influenced by our own experience. Something like our culture might really influence the way we look at things, as well as our lived experience. Maybe we had some very negative experience around sexual violation or sexual touching, or all that might also affect us. Also, the way our religion may also influence the way we see sexual development. How behaviors were modeled when we were growing up with our parents, our uncles and aunts, our grandparents, neighbors, etc. Our gender, how sexual development might change for women versus men, or for trans, or someone who's gender neutral. Sexual orientation, development of a straight child might look very different than a queer child, etc. So that is really important to understand where we're coming from when we are caring for children. So each nation and family carries its own teaching. No one way is the same. Some family values modesty, privacy, and boundaries. Other encourage openness and curiosity without shame. Honoring these teachings help us guide children in ways that respect their family and culture. Cultural context prevents us from labeling or judging behaviors, and that may have different meanings across cultures. Caregivers are invited to reflect on their own teachings and values and how these shape the way they guide children. So when does sexual behavior in children become a problem? Well, problematic sexual behavior means that the behavior poses a risk to safety and well-being of the child, as well as other children or adults. It may also signal an underlying disorder or a form of abuse. So I would like to use the traffic model. So the green, amber, yellow, if you want, red. So green is when it's healthy, sexual behavior, like typical discovering your body kind of thing, like curiosity, easily redirectable. They're connected with the same age group, etc. When it's concerning, yellow, is when it's frequently secretive, unequal power age with the relationship. There might be a power age scenario that is not quite healthy, and it's really hard for us to redirect them. When it's really red, it is harmful. When it's force, when there are threats, when it's significant age, power gaps, distress, and pain. In both the amber and the red, this is where you need to consult, you need to increase supervision. And when it's red, you even have to report, because it is the law and it's a duty to report. So this here is just a little chart of when it becomes problematic. So for ages 2 and 3 is when there are sexual transmitted diseases, bruise around genitals or on the face. And these are also true for all the other age groups. And you will see age 4 and 6, 7 and 12, it's actually the same. Cannot redirect their genital play or masturbation when asked. Have excessive interest, knowledge, or language about sexual behaviors. Act out sexual behaviors not typical for children of their age. Have knowledge of sexual behaviors not typical for children of their age. Have behaviors typical of a younger child, or overly concerned about their bodies. For example, wearing a lot of multi-layers of clothing. They're trying to hide their bodies. Or it's revealed at extremity. I'll give an example. I had a 13-year-old. So I was the 12th placement when he got to me. And he was, his mother was in the sex trade industry. And towards the end of her career, she was more involved in erotic dancing. So she had a poster as well, 1-800, with 2 stars on her nipples and a star on her vagina. And he took that poster and he wanted to put it on his wall. I mean, who am I to judge? That is his mother. So we had to come to an agreement to put the poster, because his closet door was a door that opened. It wasn't a sliding door. So we were able to put it behind that door and he could have the door open. But there was a lot of sexualized behavior. As I worked through that with him, and I kind of, for me, was concerning, then it became more red, is I found out that when he was a child, she was in a brothel home, and some of the Johns that would come would want him to be involved in their sexual acts. So that is the time where he said he felt the most close to his mom because his mom was trying to protect him. So he didn't find it. He found it was special time with mom, but it was dysfunctional. And then he became very sexualized. So there was things that we had to work through it with counselors and so forth. So that was a red flag. We had to flag it down, and we had to we had to call for sure. So this is the MCFD, that is the Ministry of Child and Family Development definition of sexual abuse. So sexual abuse is when a child or a youth is used or likely to be used for sexual gratification of another person. So unexplained or persistent pain, bleeding, or unusual discharge in the genital or anal area. Pregnancy, sexual transmitted infection. Behavioral and emotional indicators. Engages in age-inappropriate sexual play or exhibit age-inappropriate sexual knowledge, for example, through drawing and playing. Forces or coerces another child to engage in sexual play. Insert objectives into vagina or rectum. Direct sexual intrusive behavior to adults. Has unexplained gifts, new clothes or money, has changes in school performance and attendance, is secretive about new friends, activity, phone calls, or internet use, has unexplained development setbacks, for example, was toilet trained, but reverts back, is involved in sexual exploitation activities such as performing sex acts for money, is involved in behavior such as misuse of drugs or alcohol. Stealing is another one. Fire setting, flinches when being touched. The laws in BC. So the laws in BC is we look at age of consent. So it's 16. All sexual activity for consent is 16. But close in age have exceptions. So 14, 15, partners have to be 5 years older or younger. Now, I struggle with that because that's as long as there's no trust, authority, or exploitation. I struggle with that because if I'm 14, 5 years older is 19, it's the law, apparently it's acceptable, but you have to really understand, is there a trust authority issue going on, etc. But that is the rule. That is what the law is. For 12 and 13-year-olds, it's 2 years older and no trust, authority, or exploitation as well. So 16, 17-year-olds cannot consent if a partner is in trust, authority, dependency, or exploitative role. Exploitation factors, age gap, secrecy, online, contact, control or influence. And key point here is that any sexual activity without consent is a crime. So this is a British Columbia law, and it's mostly like that across Canada as well. So some of the stats here in BC is that, and some of the stats are Canadian as well, but I'm talking mostly about British Columbia's. It is underreported. It's only 5 to 6% of all the assaults reach police. So BC youth, 12 to 17-year-old, 14 report sexual assault, another 10% reported sexual violation. Now this one is a big one, online harms. So 4.3 million reports of child exploitation between year 2014 to 2020. That is from the Canadian Centre for Child Protection, CyberTip. These reports include child sexual abuse material like luring, sextortion, online grooming, and non-consensual sharing of sexual images of youth. Why it matters? It highlights that digital environment are now a major context for child sexual harm. For Indigenous folks, 27% report sexual violence before age 15. And for queer folk youth, it's 2 to 3 times higher risk of abuse versus heterosexual peers. And trans youth faces the highest rates of violence and sexual harm.
And we just have a question from the
Yep.
chat, just to
Yeah.
clarify some language.
Yes.
Someone is asking just a question about terms. What is the difference between genital play and masturbation? So are those two words that mean the same thing? Or is it some sort of intensity, or is there another distinguishing factor between them?
That is such a great question. So sometimes it can be masturbation, and sometimes it could be genital play where little kids might be discovering each other's bodies and they're just playing. They're not really masturbating with each other, but they're playing with each other. And it's maybe a game by touching each other's penis or whatever, or a game of seeing which penis is bigger, or whose butt is bigger or whatever. That might be more of a play. Masturbation is when it's a little bit, when it's like provoked, if you want, like touching where you get erection and so forth, or there's an intent. With masturbation, there's more of an intent of sexual I'm speaking in French in my head, sorry. Not erosion, but it's more you have an intent to arouse sexual behaviors and
Perfect.
feelings.
Thank you
Yeah.
so much.
I hope that answers that question. The next one is a clip, and it's only about 2 minutes long. Yeah.
A child can have a variety of behavioral signs after they've been abused. With younger children, oftentimes you're looking for detailed and age inappropriate sexual behaviors. So if they have not been exposed to a particular type of sexual behavior and they're displaying that, you want to be more concerned, because where would they learn that sexual behavior? Now, for instance, if they've seen mom and dad having some intimate relations, or they've been exposed to something on TV that had a sexual nature to it, or some pornography or something they saw in a magazine, they may imitate that. However, if they've really never had exposure to those kind of sexual matters, then you're going to be more concerned if your child is displaying those types of behaviors. In addition, younger children may also have this fascination with sexual matters and fascination with the genital area. That's going to raise a red flag. Also, they may have sort of behavioral issues of being more clingy, starting to wet the bed at night again, or soiling their underwear. A lot of these different aggressive behaviors, just sort of telling you that something's not right and they're just not doing okay. With older children and adolescents, you will often see, again, drastic changes in behaviors. So it's not whether it's a positive behavior or a negative behavior, it's drastic changes. They may, again, be on the negative side, where they become more truant, they become more aggressive, they start having poor school performance, they start having difficulties with peer relations, or they may be on what could be perceived as kind of a positive side, in that they become more hypervigilant and they want to be the perfect child. They want to become the straight A student and clean the house and take care of everything, because they've been in a situation that they're completely out of control, but now they want to control that environment around them. So sometimes you'll see the negative behaviors, sometimes you'll see the positive behaviors. Also, with older children and adolescents, you will sometimes see them taking on more high-risk behaviors, such as drug abuse, alcohol abuse, sexual promiscuity, also self-injurious types of behaviors. They may run away, and then also, really the extreme also is they may attempt suicide or actually succeed in suicide.
Thank you. So that's why it's really important to talk about this, because it's people's lives that we are dealing with. So, and little lives, young lives, that has a whole future in front of them. So the mental health impacts of sexual abuse and sexualized behavior. Well, there's emotional and psychological. So there's a lot of kids that will demonstrate anxiety, depression, distress, shame, guilt, identity confusion, and attachment difficulties. The trauma response for post-trauma stress disorder, it is that disassociation flashback. I remember one of my kids that I was caring for was at a window washing dishes, and right at that time there was somebody outside that he saw that actually abused him, and then he froze, and there was a flashback. And so that even happens, and he kind of stopped washing dishes and was just frozen. He froze right there. So I had to work through that with him. Nightmares, sometimes nightmares, wetting the bed is what was mentioned before, hypervigilance, self-harm, suicidal thoughts and behaviors. Behavioral and social, there's that impulsive risk-taking. So might get involved in substance misuse, eating disorder, personal disorders, body and self-image. So low self-esteem, body dissatisfaction, and disrupted sense of self. So the next one is the physical and sexual health. So there might be some sexual dysfunctions, sexual transmitted infections, chronic pain and fatigue, headaches, digestive problems, insomnia, pregnancy. And so I had kids that had major constipation issues, and others had major diarrhea issues. Two extremes, and it was all connected with their abuse as well. Relational there are lots of strains on relations, or loss of family ties, difficulty forming, maintaining intimate relationships, and parental relationships as well. Social, very aggressive, delinquent, school suspension, social isolation. Educational and economic, poor academic performance, school dropout, job insecurity, low income educational levels as well. So if you find these things, we do have a duty to call. And I believe there are some people online that are not from British Columbia. So this is not this is a British Columbia phone number here. So if you are not from this province, you're in a different province, please look at who you have to call when you have to do a duty of report, when you have a child abuse concern. Thank you. So consent to sexual activity. So the sexual activity, sexual offense, is in the criminal code that protects all Canadians from sexual abuse and exploitation. So it not only includes adults, it also includes children of sexual assault, sexual assault with a weapon, aggravated sexual assault, voyeurism, trafficking in person, and consensual distribution of intimate images. Child sexual offense is also in the criminal code. It also protects children through child-specific offenses, including sexual interference, invitation to sexual touching, and sexual exploitation. Okay, now we're going to go to the next slide, and we're going into the next subjects is now, you want to know tips. You're a caregiver, and you're like, okay, now I know all this. What do I do? So we're going to look at different tips to help caregivers. So, trauma-informed and centering healing through Indigenous culture. I think, yeah, let's do this video. It's 2 minutes long.
Parents will oftentimes wonder whether or not their child's going to tell them whether something happened or whether or not they've been sexually abused. If you look at the statistics, the mean time between assault and when a child may disclose is 3 years. So I think oftentimes that's very difficult for a parent because they feel, well, I'm very close with my child. My child will tell me anything. I feel like they should be able to tell me anything. Is there something I did wrong and they're not telling me? Are we not close anymore? And I think you need to reassure yourself that as long as you have been providing that support for your child, it's not out of the norm for a child not to tell right away. Some of the things that might instigate a child to tell, it's just very variable. Sometimes it's in school where they get the good touch, bad touch talk, or the police come in to talk about stranger danger and safety things that the child will suddenly disclose to the school teacher, or they may come home and disclose to their parent. Sometimes it's just something that happens where the child may have been molested multiple times, but something happened that made them tell. Just as an example, we've had a situation where the reason the little girl ended up telling was because the molester, the perpetrator, didn't let her watch her favorite TV show. And that's what just took her over the edge, is he wouldn't allow her to watch her favorite TV show, so she decided that she was going to tell somebody. So there's various reasons, and sometimes they may not make complete sense to us as adults, but the child has their various reasons on when they're ready to tell. As a parent, the main thing is to be supportive, letting your child know from the very beginning that they can always tell you if something makes them feel uncomfortable, if any person in their life is making them feel uncomfortable. For a younger child, you may ask them, does somebody make you feel icky? You know, they may not understand uncomfortable, but they may be able to tell you, yeah, he made me feel really icky and I didn't like it. Again, you don't need to interrogate your child, but just be open to listening. If your child starts talking about something that happened to them at school or when they were at their neighbor's house or wherever, just listen to what they have to say. Again, you don't need to be the investigator and interrogating them, but listening, being supportive.
And that is totally what we're going to say. So the next slide is exactly that. When addressing concerns, behavior of any kind, it's important to ask questions like, can you tell me what made you want to do that? How did you learn about this? What were you hoping would happen? Stay calm. Sometimes it's hard to stay calm, but it's really important. Take big breaths. Stay calm. Keep your voice steady and gentle. Take a good, nice, long breath and deep breath before responding if you feel shocked. Use body language that shows openness. Don't punish. So don't say something, that's wrong. Don't ever do that again. Try, I want to understand what happened so we can make sure you feel safe and know what's okay. Separate the child from the behavior. You're not in trouble. Let's talk about what you did and why. So teach boundaries. So your body belongs to you. You get to decide who touches you and how. It's okay to say no, even to an adult. If you're ever unsure about what's appropriate, you can come and talk to me. So those are things like kind of just opening that discussion, listening, having these open-ended questions, not judging, not blaming, but open and not punishing. These conversations about teaching body safety is going to be an ongoing conversation that you have with your child. It's a not one-time conversation, but all the time. Build conversation gradually, adapt to age, context, and maturity. Healthy versus unhealthy relationships. Talk about power dynamics, secrets versus surprises, and what feels safe. Trusted adults. Have children name 5 adults they can turn to. Remind them to keep telling until someone helps them. So identify those 5 adults that they could go to. Clear language. Teach proper names for body parts to support understanding and to disclose. And really important, revisit often, reinforce learning, and check how children are applying it over time. So the role of culture. For children who have experienced sexual abuse and problematic sexualized behavior, their sense of self is often shaken, and they may carry shame and confusion. By engaging with culture, children can find themselves or refine themselves in positive identity. This belonging can counteract feelings of isolation and worthlessness, which are common after abuse. Elders, knowledge keepers, extended families, community members all have a role to play. Culture helps the child see that they are surrounded by support and that they are worth it and are recognized by many. For caregivers, involving the community also provides more resources, guidance, and cultural contacts for how to support your child. Connection with self, others, and land brings wholeness. Healing others strengthens community for future generations. Seeing cultural as a method of healing recognizes at the same time a deep, intimate, and personal experience and a relational and collective process. Now, trauma-informed. Awareness trauma can overwhelm coping and daily functions shaped by context, support, and history. 5 types of trauma. One is a single incident. So it might be a very specific and overwhelming event or episode. Complex it's an ongoing series of overwhelming events or episodes. Developmental is a result of early exposure to complex trauma and impact healthy attachment development. And intergenerational can be experienced by those who lived with survivors of trauma. Historical is a cultural or ethnic group who experience a trauma based on culture and ethnicity. So like our residential schools, and we know that many have been affected by sexual abuse. There might be some historical from one generation to another, that intergenerational, which is also historical. The approach is recognizing behaviors may have multiple root causes. Support requires wraparound, holistic care that addresses past, present, and future. So the qualities of trauma-informed healing. So the qualities of when you're trauma-informed is awareness. Being aware of how trauma can impact the child's development and how this may impact other aspects of the child. Safety, adapting your own language and space to provide a reassuring and trustworthy atmosphere. Connection is communicate clearly to address relationships, allowing to express without fear or judgment. And strength-based, move away from shame and guilt, but more towards social learning. Okay. So the intervention is, there's lots of different ways to intervene, but one for sure they will need is counseling. It's a supportive space to address the impacts and building coping strategies and resilience. Educational programs. There are a variety of programs out there of age-appropriate programs promoting healthy relationships, language, and safe behaviors. Family support involving other family members in the intervention may create supportive environment for the child. Working with professionals, very important. Build a supportive team. Identify and maintain contact with professionals involved in the child's life and journey in healing. Share relative information to the professionals to keep them informed while being respectful of the child's dignity and their right of privacy. Be an advocate. Ensure that the child's cultural needs and voice are being heard and respected. Coordinate with cultural supports. Where possible, integrate elders, knowledge keepers, or community mentors into healing plans alongside other professionals. And prepare the child for professional interactions. Explain the various persons or situation using age-appropriate or cultural grounded language. Okay. So for us caregivers, we need to do a self-reflection. So acknowledge your own emotions. Healing alongside a child can stir grief, anger, guilt, and helplessness. Recognize these feelings for yourself is the first step of caring for yourself, and then you'll be in a better place to care for the child. Prioritize cultural and personal wellness. Engage in your own cultural practice, ceremonies, or grounding routines to restore balance in your life. Set healthy boundaries. You cannot pour from an empty cup. Caring for yourself supports your capacity to care for the child and your community. Seek your own supports. This may include therapy, talking circles, elders, friends, or peer caregivers as well. Other caregivers that may be going through the same thing. Okay, go ahead. So these are resources and supports that exist. So 991 988 Victim Link BC, that's the number that you have. Kids Help Phone, Plea Community Services. Now, these are mostly British Columbia numbers. So if you're out of the province, you might have your own set of numbers, but please do that research for where you're from. Needhelpnow.ca, CyberTip.ca, Connect Safely, that is a website that you could go. Very good website. Actually, yeah, that's a good website. ProtectKidsOnline.ca. These are all good websites. Resources and supports, again, there's the Indigenous Child and Family Mental Health Services here in BC. Pathway Support Services, Urban Native Youth Associations, representatives for child and youth, that's in BC as well. Indigenous Youth Roots, which is also a Canadian site. Okay, the next one is that, and then after that is a thank you slide. So we could probably unshare. Thank you. Thank you.
Great. Thank you everyone so much
Yeah.
for attending.
Yeah.